What are the pros and cons of natural birth? Maybe we should be asking the question, what are the benefits of natural birth? And I'm not just talking about unmedicated birth or vaginal birth. What I'm talking about is physiological birth, the true natural birth. And today, inside the Empowered Birth series, I'm going to go deep into the benefits of true natural birth. Because oftentimes, what moms forget and what we've been taught in our birth culture is that there is a huge difference between true natural birth and natural birth perpetuated by our birth culture and medical system. Next week, I'm going to be talking about the natural birth traps themselves. But if you want to know more about that, I also talk about it inside my book, Your Empowered Birth, which is available on Amazon. And you can also listen to the entire thing inside of the YouTube channel in the book playlist. Let me just break it down for you, though, because so many people get this wrong. True natural birth, the physiological process, is what you're thinking when you say, I'm just going to birth my baby and everything's going to work out. And if there's something that goes wrong, then I'll call in medical intervention. That's what you're thinking. Unfortunately, what is perpetuated within our birth culture and medical system is not that. So Jenny put this another way where she's like, I'm just going to go in and I'm going to birth my baby and everything will be fine. But unfortunately, she fell into the natural birth traps. She also was a high risk mom, and therefore she was already on the path to medicalized birth when she was pushed into an induction. So she'd read Ina May's Guide to Childbirth, and she knew that there were benefits to natural birth. One of the big ones, of course, is that if you have a natural birth, you're not having a C-section. That in itself is already awesome, right? Because you don't want to have major abdominal surgery. And yes, it can be life-saving. However, we also have a very high C-section rate, and it doesn't really work for our population because there are a whole bunch of problems that come with this high cesarean rate. Go back and watch some of my other videos where I talk about the complications of C-section. You can also learn about that by reading Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, The Thinking Woman's Guide to a Better Birth by Hensi Gore. I mean, this is everywhere. We know that a C-section leads to more complications long term. This isn't rocket science, right? And we really want to avoid that. If you're watching natural birth education in the first place, I'm going to guess that you would like to avoid a C-section. The other thing is, of course, the epidural. So many people will tell you that the epidural is not that bad, that it's not going to cause complications. But I have talked to moms who have had complications with the epidural. Long-term back pain can be a result of the epidural. And that's just one of the issues. It can also lead to a C-section. Same with induction, same with having your baby pulled out of your body without allowing you to have the actual process of pushing when your body wants you to push, instead of being flat on your back and purple pushing. Again, these are all things that happen, and these births are still called natural. We have an epidemic in our culture where people will just say, how dare you say natural birth? And it becomes a trigger. But why is it so triggering? Well, the reason it's so triggering is because we're made to feel like it's our fault that we didn't have a natural birth. We're made to think that it's because our bodies are too big, our bodies are too small, our pelvises are too small, our babies are too big, our babies are too unhealthy, we're unhealthy, we're too old, we're too fat, we're too young, all of these things. And the truth is that it's not that. There are women that have high body mass indexes and they still go on to have completely natural births at home. There are women who have type 1 diabetes and they have births at home. There are women who have twins and they have births at home. And, you know, today we're really going to go into those benefits of true natural birth, not just to point out that natural birth is awesome, but also to recognize that there are really things that are going to be lost if we keep going down this path of medical birth and allowing our birth to be controlled by the medical system. So the aim of the empowered birth method is simple. We aim for a true natural birth, and then we create our backup plans for when we want to bring in medical intervention. And everything within the empowered birth method and the do-it-yourself path is to teach you how to say no, teach you how to say yes when you want to say yes, teach you how to make empowered decisions about your birth, and teach you how to bring in the support that you really need. You also get a crash course in physiological birth education because, again, this is something that's not being taught very much, or there's a lot that's being lost in translation. The natural birth community is all about giving you tips on how to do things to prepare your body for birth. And while these things can enhance it, your body is already designed to birth. You just have to get out of your own way, and you need to also get past your fear. But the fear has been culturally ingrained. And that is why the empowered birth method flips everything on its head. You are your own best expert. You are already going to birth your baby with or without permission, and with or without anybody telling you what to do. You tune into your own instincts. You are the decision maker in your care, and you are the birth consumer. So if you go to my website, empoweringmomsbirth.com/start guide, that will give you the overview of the empowered birth method. If you're new to me, then I highly suggest you check out that guide. It is a comprehensive look at everything that you need to know to plan and get your empowered birth. I tell you about the 3 paths to getting the empowered birth method, and this one is the do-it-yourself path. That means that every single video masterclass is a deep dive training on how to plan and get your true natural birth and to have an empowered birth if you choose to bring in medical intervention. But you're choosing it, not the medical system. That's the key. And you get past your fear and you advocate strongly for yourself. So if you are taking the do-it-yourself path, I'm also going to remind you, if you find value in this video, to please like, share, and subscribe, pay it forward. There are more tips on the website at empoweringmomsbirth.com/start guide on how to get the most out of these trainings. But what I'm going to suggest you do is take notes. So if you're only having a little bit of time, like 10 minutes right now, and you don't have time for a deep dive, that's okay. Make sure you bookmark this, come back to it when you have the time to spend to really pay attention, because I'm giving you free birth education, because I'm committed to you having an empowered birth, whether you work with me or not, whether you buy my program, Your Empowered Birth Academy, or whether you become a premium coaching client. I want you to have an empowered birth, because when you have an empowered birth, you're an empowered mom for life, and no one can take your power away from you again. And you may think that something as simple as liking, sharing, and subscribing isn't going to make a big difference, or leaving a comment isn't going to make a big difference on social media. But the truth is that the more you engage in the videos and the social media, even if you're not spending money directly, energetically, that is an exchange. So by doing that, you're going to allow the videos to be visible to more people. You're going to be able to pass this on to other moms that really, really wish that they had this education. You have no idea how many moms have come to me after I've shared something with them. And they're like, I wish I'd found you sooner. I wish that I found you when I was pregnant with my first baby. There are women in their 80s and 90s who I talk to sometimes, and they say, I wish you'd been around when I was having my kids. And it's like, yeah, I know. Like, this is something that's been ongoing for generations. And that's why it's so important that we get the word out. That's why I wrote my book, Your Empowered Birth, because when I was a first-time mom, all they had was the typical natural birth advice and the typical medical advice. And I didn't have anything in the middle to really show me what was going on. Whereas with Your Empowered Birth, I took everything that nobody told me that I had to figure out on my own to be able to get my empowered birth with my daughter, to be able to experience the benefits of natural birth, true natural birth at that. And then I was able to then put that into a book form, and I put it on Amazon. So if you do want to support the empowered birth movement, you can get the book on Amazon. It's available in Kindle, and it's also available in paperback. Or what you can do is you can just listen to it on YouTube and get the overview. You can also invest in your Empowered Birth Academy that gives you everything that I've created. I continue to put trainings in that. It's evergreen. And basically, what you're paying for is the email support. So that way you can go back and forth as you're going through the material, and you can ask questions of myself and my team. We get back to you within 1 to 2 business days. And you can be like, cool, I can keep going through this course, because a lot of moms, they buy courses, they don't even open them. Or what happens is they just don't know where to start. It can be a lot. And I want to walk you through that because I am committed to you having an empowered birth. Okay, so now that that's out of the way and you understand that if you want to know more about the empowered birth method, you just go to empoweringmomsbirth.com/start guide. Let's get into those benefits, okay? So one of the benefits of true natural birth is that you are going to have a much easier postpartum. In fact, there are so many moms that I've helped with the empowered birth method, VBAC moms at that they are just blown away by how good they feel. Maybe they're just a little sore, but they still feel like they can take on the world. And because they're my coaching clients, I remind them, even as they're pregnant, it's like, remember, you are going to want to take on the world. You're going to want to go and shop. You're going to want to go out to the park. You're going to just be like, I feel so great. I'm not stuck in the house for 6 weeks or longer, recovering from major surgery. Instead, I just want to go places. I want to get out. Like I've lost all the baby weight pretty much because the baby's out. So I'm not heavily pregnant and I can go and do things. And I remind them, for the first week, they're in bed. The next week, they can be around the bed. And then the final week, they're still in the house, kind of. Maybe they can go out every once in a while if they really need to, but try to stay close to home. Because the thing is that your baby is still recovering and you're still recovering, where your body is trying to get back to where it was before pregnancy. Your baby is now adjusting to the outside. You've got all these hormones running through you. And it's just a lot easier of a recovery the more you're resting. So having that easy postpartum allows you to then be able to show up stronger for your baby. One of the things I suggest to all of my clients before they even have their baby is to have their postpartum plan. And if you don't know what your postpartum plan is yet, I'm just going to remind you at this point that I do have a birth vision workbook. You can just write to my team, hello@empoweringmomsbirth.com, or you can go and sign up for the Empowered Birth newsletter. You just go to empoweringmomsbirth.com/start guide to learn about the free path, because I talk about the Empowered Birth toolkit in there. Or you can go and get the entire program, your Empowered Birth workshops, and that comes with the workbook and the entire course to show you how to go through the workbook. So those are your two paths. You just write to hello@empoweringmomsbirth.com, or you can go and get your Empowered Birth workshop. It's also inside your Empowered Birth Academy, but that's like our whole program. So if you just want the starter, then your Empowered Birth workshop is the way to go for that. So recognizing that you have this postpartum plan, and then you also are planning ahead of who to call if you have breastfeeding issues. Who is going to do the laundry for you? You don't need to be doing it yourself. Who is going to be taking care of the chores? You don't need to be doing that yourself. Remember, you're in bed for at least 1 week after birth. And I tell my clients and their partners, I say, Dad, you are going to be doing most of the lifting and you're going to be making sure that mom's taken care of, right? And he's like, yeah, I've already got it planned. I may not be able to be there physically for this part, but we've got somebody coming in. I've hired a postpartum doula, or my sister's coming in, or her sister's coming in. Somebody is going to be there to help. You also want to be planning for meals, something that's nourishing for you, and that's going to aid your healing. But because you're having a physiological birth, you are more likely to recover faster because there is no external injury from interventions. Your hormones were not hijacked. So your body is able to then basically adjust itself. If you had an IV during labor, however, this can also lead to a lot of fluid retention, which can cause issues. If you had a catheter because you had an epidural or for some other reason, that can lead to UTIs. If you happen to have a C-section, oh my goodness, that is a much longer recovery than if you were having just a completely physiological birth. And of course, if you had the epidural, that can cause issues too with your back and your spine, because it is a needle in the spine. You need to be honest about that. You could have an epidural headache. And not only that, but if you were also purple pushing, then your pelvic floor is all messed up. And that can lead to problems when you're trying to have a bowel movement later. I noticed a complete difference between my pregnancy with my son when he was born versus with my daughter, because I was like, oh, I was afraid. I was afraid to go to the bathroom. And then when I did on the first day, I'm like, oh, this is nothing. This doesn't hurt. This isn't scary. This isn't like, it's not difficult. But in the hospital, it was because of the way that they had basically told me to purple push. So the more you are able to recover postpartum, the more you're going to be able to come back to yourself and be able to take care of you and take care of your baby, and everything else around you will just be so much easier. So much easier. Night and day. Even Jenny commented on how it was just night and day with how her recovery was, because there's also the fact that you're not dealing with birth trauma. And when you're not dealing with birth trauma, you feel more confident to be able to take care of your baby. If you have unprocessed birth trauma, this is also going to affect your mental health, and you're not going to be aware of it until you realize down the line what's going on. And I recognized that even with my easy vaginal birth at the hospital, when I came home, I was very anxious. And it wasn't just because I was a first time mom. I'd babysat before, I'd changed diapers before, but I was feeling really out of place and I didn't know why I was so overwhelmed. So I was thinking to myself, well, it must be because it's just hard being a new mom. But I didn't have any breastfeeding issues. And it wasn't until about the 5 or 6 week mark when I went into this birth trauma support group that I didn't think that I belonged in. And then I was starting to tell my story about how hard motherhood was. And I realized that actually it was all tied to this story of like my birth and the fact that I kept saying, well, I got the baby out, so I'm good. I was not. I was not fine. And it took a while for me to unpack that. And I was unpacking that in the first year of my son's life. So that made my first year so much harder than it needed to be, because I was also dealing with my own trauma and my own upset over what had happened. And I was also trying to be a birth advocate at the same time and taking care of my son and doing all of the things. So this is why I've noticed when you have an empowered birth, it's different. And I'm going to tell you that after I had my daughter, things had already been falling apart with my partner. Like he had already been really awful during my pregnancy, and he had been really awful in the postpartum period. There was a point where he had actually threatened to leave me. And the reason wasn't because I was a mess. The reason was because I wasn't a mess. But nobody seemed to like that I was now so self-assured. And they kept saying that there was a problem with me. And I'm like, no, I'm happy. I'm fine. And then they're like, you're not fine. You're not doing what you're supposed to do. You're not doing what we expect of you. You're not fine. And he kept doing that 3 days after my daughter was born until I burst into tears and was like, I guess I'm not fine. But it was very short lived, because then I'm like, wait a minute. I was fine. Why did this happen? And this is how I came to the conclusion about the gaslighting. So I'll tell you more about that later. But the fact is that when you are recovering, your postpartum is going to be easier. That's the takeaway. Your postpartum is going to be easier. However, it does become easier. It doesn't just necessarily mean physically, it also means emotionally and it means mentally. So the next thing, of course, is that breastfeeding is going to be easier. Number two, breastfeeding is going to be so much easier if you have a physiological birth. And the reason for that is because now your body is producing the right amount of hormones for your milk to come in and for your baby to be completely alert. Babies who are born physiologically instead of drugged up are much more alert than babies that are not. So the baby is able to then do the step reflex on your belly, which then massages your uterus and basically says, okay, baby's on the outside. And then the placenta is going to detach faster. You don't have to do that bread dough kneading, and you don't have to be pulling on the cord. In fact, one of my clients, Rebecca, she was just sitting, chilling out on her bed, and we weren't even worrying about the placenta. She wasn't bleeding, so we didn't have to worry. She was just doing her usual thing. She was just sitting there with her baby, and she was nursing her baby, and she was having some food. And then after a while, we're like, okay, so the contractions have stopped. And it's like, yeah. And it's like, and you feel fine. It's like, yeah. And it's like, but the placenta's not out yet. It's like, no, it's not. I can't feel it. And this is at the point where I called my dear friend who happens to be a childbirth educator, and she understands physiological birth. And she's like, okay, but how's the bleeding? And I'm like, there's none. And she's like, okay. And of course, I'm on Zoom with my client, and I'm also on the phone with this childbirth educator. And she's sitting there and she's like, okay, no major bleeding or anything, no gush of blood, but like try standing up. And of course, she couldn't seem to it was basically just sitting there. And she's like, okay, all you need to do is gently pull the cord now with the cloth around the cord and just have dad pull the cord, or some pimply faced teenager is going to do it in the hospital. And we pulled and it was out. But, that was after several hours. So you need to recognize that the placenta could just be sitting there in the birth canal and you don't even know it. That's a whole other story. You can also learn more about this if you learn more about physiological birth, and I will be talking about it in later videos. But the idea of the breastfeeding, baby's kneading on your belly, the placenta is released, that then stimulates the hormones to produce the milk. And if baby is also alert, baby is more likely to latch on properly than if they are shoved on. I made the mistake after my second birth where I did not allow my daughter the time that she needed. I did not recognize her personality for what it is yet. And it's very much, I'll do it when I want. Even now, at almost 9 years old, she's still like, I will eat when I'm ready. But I was trying to get her on the breast. I was impatient. And because of that, she had a very shallow latch because she just didn't want to do it. Also, my cups ran over. So I kind of recognized that maybe her tiny little mouth would have a little bit of difficulty. But at the same time, that's just a latch problem. That's not your milk not coming in. And the thing is that if you lose a lot of blood volume, your body is going to be choosing between making milk or making more blood. Guess which one it's going to choose. More C-section moms have problems breastfeeding because of the fact that they've had a lot of blood loss. Moms also have problems breastfeeding if they have had the IV. This is again because of the retention of fluid. And then the other thing about that, because they've retained fluid, guess who also is retaining fluid? The baby. So the baby's birth weight is inflated at birth, and they don't factor that in. Now, a few days later, as you're breastfeeding, your care provider is saying, hey, the baby's lost way too much weight. We need to supplement. Well, no, actually, your baby was fine. It's just that all of those IV fluids ended up getting into the baby's system and inflating their birth weight. And now you're being told you have to supplement, and you're worried you're not making enough milk. So you need to take that into consideration. The other thing, of course, is that if you're induced, then this also leads to issues. And you can go and listen to the podcast episode. I think it's like number 2 or 3 of Midwife's Cauldron, where Rachel Reed and Katie James actually talk about induction from the baby's perspective. And there was information on what this does with breastfeeding. So if you are wanting to breastfeed, then having a natural birth is the logical step to do this, because otherwise you're going to run into a lot of problems that could have otherwise been avoided. So aside from the long-term health benefits to you of having a natural birth and the short-term health benefits to you of having a natural birth and being able to have a much easier postpartum recovery period because you didn't get severely injured during your birth and your baby being able to breastfeed, the last benefit of true natural birth is that you are tuned into your body in a way that you may have never been tuned in before. Now, part of my process with my clients, depending on when they start working with me, some of them are working with me from up to a year, some of them even before they conceive. Some of them do it when they're like 6 months along. Sometimes it's 6 weeks though. So based on where my clients are at, I'm still asking them to tune into their body, especially during those last weeks of pregnancy, to really just let everything else go. Let go of all the shoulds. Let go of all the doing on the outside, because birth is really about being. And the more you can tune into your body during pregnancy, during labor, and during birth, the more likely you're going to be able to tune into your body in postpartum and be able to move with the flow of your body as you get older. You know, when I was younger, I used to hate my period. I hated it so much. I used to be on birth control pills. And even after my son was born, I was thinking to myself, I don't want my period back. Now, I didn't get it back until about 2 years after he was born. So when he was 2 years old, that's when I got my very first period back after pregnancy. And it was brutal. Now, the thing is, I've recognized that there's a connection between doing too much on the outside and not listening to your body and period pain. Because even though I had really brutal periods when I was younger, and it was mostly because I was pushing on the outside and basically just doing all of the things and not resting, not honoring my body, not honoring my cycle. And the result, of course, was more pain, more exhaustion, more irritability. Now, when my period comes, I welcome it like a friend, because I'm like, okay, this is my time of rest. This is my time of being able to not worry about the outside. And by doing that, by honoring my cycle, I've actually been able to tap into my energy reserves. I've also been able to teach my children that it's okay to rest. And because they know how to tune into their own body, they intuitively eat what they are wanting when they're hungry. They're able to basically regulate themselves. They tune into their need for sleep. We don't have a rigid schedule where they're like, oh, well, I have to sleep this much every single day. Instead, it's like, I think I need a little bit more sleep today. We get less colds this way. By tuning into your body and being able to do it intuitively, what happens is that if you start to feel a little bit run down, you're able to take that time to be like, okay, we only have this thing that we have to do, and we're going to drop everything else, and we're going to take more time for rest. So my toddlers and preschoolers rarely got sick because I was able to tune in not only to myself and how I was feeling, but I would be able to recognize the signs very early and catch them before it went into a full-blown cold. I was always able to tell when my kids were getting run down. I was always able to tell when they needed more sleep. I was always able to tell when maybe they'd had enough of a person and they needed a break from people and they needed to go inward and do something on their own. I was able to tune into that because of the work that I had done during my pregnancy and during my birth. So the more you're able to tune into your own ebb and flow, this then allows you to be able to move through life seamlessly. The other thing about having a true natural birth is that because you're recognizing your own internal process, birth is a metaphor for life. So if you look at challenges in your life as transition rather than an obstacle that you can't get over, then you're able to move through it because you know on the other side is going to be something new, something powerful. When you recognize that there's challenges during your pregnancy, and maybe your care provider is putting up a wall and saying, no, you're not allowed to do that. By using the skills of birth advocacy and what I teach in the empowered birth method, you can then take those same skills later after having accomplished this goal and not being afraid to say no to your care provider. You can take that into other areas of your life. But if you just keep trusting the experts and you just keep listening to what other people tell you to do, and you don't trust your body and you're not tuned into it, and you're actually thinking that your body is broken and defective instead of recognizing what's really going on, then you just keep falling into those same traps over and over again. You just keep falling into them in your career, you fall into them in your parenting. You make decisions for your kids that later you regret because you're like, you know what? That wasn't actually right for them. You make decisions in your marriage. Maybe you stay in a partnership that really isn't serving you. There's so much fear and there's so much trauma in our world. And it has been perpetuated for generations. And what I've noticed is that when moms have an empowered birth, they suddenly reclaim all of their power. When moms have a physiological birth, they tune into something primal. And if you want to know more about that, you can always go check out Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, because that's really what it is. It's an initiation into motherhood, or a reinitiation into motherhood if you've already had one or more children. And every time that you rebirth yourself, you become stronger, or you become weaker, depending on if somebody has basically taken your power away from you. And empowered birth is not just about having a true natural birth. It is aim for true natural birth and pull back only as much as you need. So you could have a completely empowered cesarean and still walk away feeling confident and being able to tune into your body. Because if you chose a cesarean, that means you chose tuning into your body, you recognized what it needed, and you're like, okay, this is the step I want to take. It wasn't forced on you. It wasn't that you had no choice. It was that you felt that it was right for you. So recognizing that when you're able to tune into yourself, this then allows you to say no to anything that's not right. And this is how I managed to have my natural birth with my daughter. It's also how I managed to have a natural birth with my son. Because even in my first pregnancy, as a first-time mom, I was told I didn't know what I was talking about and that I wouldn't be able to handle the pain. They didn't think I could do it. But because I tuned into myself, I asked the question, does it feel true to me that my baby's too small? It did not feel true. My intuition was telling me that there was nothing wrong with him. And my intuition was right. With my daughter, I had that stop and start labor. And the midwife was basically saying that if she kept having the stop and start labor, she might go into distress. But that didn't feel true for me either. And with Jenny, it was the same thing. It didn't feel true for her that just because she had gestational diabetes, that she wouldn't be able to have a natural birth. That didn't feel true. And therefore, she didn't listen to that message on the outside that was trying to scare her. She was able to deactivate that button. And by doing so, with the empowered birth method of getting past your fear and becoming the birth consumer, you then have all of the power to decide yes, no, counter offer. So to recap on the benefits of true natural birth, first of all, again, you need to understand it's going to be a much easier postpartum recovery, even into the first year, and your health is going to benefit long term. You're not going to have dense adhesions if you have a natural birth because you're not having a C-section. but you will have problems possibly if you go the medical route, because medical birth goes against the physiological process. So we aim for a true natural birth and we pull back only as much as needed, because that way you're less likely to have complications that are going to make your postpartum more difficult. The other thing you need to know is that, number 2, breastfeeding is a lot easier if you have a physiological birth, because the baby is more alert, your body is able to make the milk, your hormones aren't hijacked, and you're also feeling really good about yourself. Because again, it's not just about the body, it's body and mind. And your emotions are important. They also affect your physiology itself. And finally, the last one is the fact that you basically tap into this superpower of intuition and being able to tune into your body, which means that long term, you're going to be able to tune into when you need rest, when you need to let something go, when you need to set a boundary with somebody, and ultimately be able to thrive in motherhood instead of just survive. So that is what I have for you inside of the series of these 26 things that you need to know if this is your first time planning a true natural birth. Now, remember, the whole series is available inside of the playlist on YouTube. So just make sure you go into that playlist and watch the deep dive masterclasses, because I go into every single one of those 26 things, starting with the first video. Take notes. Make sure that you're also getting extra resources. If you want any of those workbooks, you just write hello@empoweringmomsbirth.com. Either myself or one of my team members will get back to you within 3 to 5 business days. If you are already a subscriber of the Empowered Birth newsletter, then you just hit reply to any one of our deep dive newsletters every single week. And then that lets us know that you are a subscriber. You'll get help faster within 1 to 2 business days. Same if you are an Empowered Birth self-study student. If you have one of our programs, either your Empowered Birth Academy or your Empowered Birth Workshop, then again, all you have to do is write to the team, just hit reply to any one of your emails in your inbox, and we will know that you are one of our Empowered Birth self-study students. We will help you, we will guide you, we'll tell you what resources to check out next, either inside the program or we'll send you something. And we'll let you know about videos, master classes that you'll want to get as supplemental education. We might even just give you a quick little video that says, "Hey, Empowered Mom," and I'll use your actual name and then custom tailor that to you, because sometimes I do that. Sometimes I just take the video and I'm just giving it to you and I give you what you need to know and I tell you what the resources that you need, and then you're on your way. And also, as a self-study student, you do know you get your one coaching call, either with myself or someone on my team. We are there to support you. And of course, premium coaching is not always available. That's why we have the self-study path. That's why we have do it yourself. So if you found value in this video and you found value in this series, make sure that you like, share, subscribe to the channel, pay it forward. Pass this on to other moms. If you want the full list, there is a guide available. You just go to empoweringmomsbirth.com/start guide. Check the resources, learn about the freebies page. Go and get your freebie, because that list is the 26 things. And next week, we're going to be starting something new. I'm going to be teaching you about the 20 natural birth traps. If you've been following me for a very long time, you might already have some familiarity with the first run of those videos that I did way back in 2022. This is going to be a much deeper dive. I'm going to go into each one of those 20 things. First, I'm going to start with the overview of the 20 natural birth traps and a little bit about each of them. And then I'm going to go into each one in detail, tell you about the risks, tell you about why it's a natural birth trap, tell you about how physiological birth actually differs from what you're being taught. These are the things that basically undermine your confidence and sabotage your natural birth process. And again, if you go to empoweringmomsbirth.com/start guide, You'll learn more about the natural birth traps, as well as inside chapter 1 of my book, Your Empowered Birth, which is again available inside the YouTube playlist. So thank you again for watching. Please support the Empowered Birth movement. If you do feel called to get the book, just know that the proceeds of the book or even the program, they will be going towards helping other empowered moms. They will be going towards funding things like birth houses. You can learn more about our mission statement and our philosophy on our website, empoweringmomsbirth.com/start guide under the mission statement and philosophy section. So if you do feel called to do that to support us further, we really do appreciate your business and we do appreciate you, Empowered Mom. We are here to support you. I am committed to you having an empowered birth, whether you work with me or not, though. So just pay it forward, pass it on, and thank you so much for watching. Have a happy, empowered birth journey, and I will talk to you soon. Namaste.